YouTube, it's Marida, and welcome to another edition of the Nurse Lounge. Happy Nurses Week. As per usual, every year I kick off Nurses Week by doing a video every single day of Nurses Week. So you are seeing this video during Nurses Week. I'm not sure which order it's going to go into. I don't want to number them in case I get them uploaded differently, but this video right here is specifically for my new nurses. So the title is 5 things that you should never do as a new nurse. If you want to see what I'm talking about, stay tuned. Welcome back. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for almost 17 years. OB/GYN and well baby nursery is my specialty. I am a nurse educator at a HBCU and I'm doctorally prepared. So with that being said, we're going to go ahead and jump right into the 5 things in which I feel, my opinion, you should never do as a new nurse. I have notes here, so if I look down from time to time, that is why, to keep me on track. Number 1. As a new nurse, you should never assume everyone is there to help you. This is the one thing that new nurses fail to realize, that everybody is not going to be happy that you are there. Why? I couldn't tell you, besides the fact that they fear that you are there to take their job. There's such a nursing shortage, like forever, that you will not take anybody's job. So I don't know why we as older nurses have a fear of that. I personally don't, because I know I can get me a job wherever I want to go. You can too, and so can they. So do not assume people are there to help you, because everybody is not. Also, to piggyback off of that, when you start your job as a new nurse, you will have a preceptor, someone who's going to orient you. Let's just be real. All preceptors are not preceptors because they choose to be. Some of them are preceptors because they are made to be. So again, if you are made to do something that you really don't want to do, how well do you think they're going to be towards you? I'm not using this or saying this as a scare tactic to scare you. I'm a realist. Me being a realist simply means that I want to know exactly what I'm getting myself into. So when I see it, I'm like, okay, they told me about this. And I don't take it to heart. I don't want you to take it personal. A lot of times it's not about you that they don't like. They just don't want to teach you anything. You know, as a new nurse, you are tending to slow them down. And some people are just not good teachers and they don't want to teach. They're like, that's not what I'm here to do. I'm here to work. So be mindful. Don't assume everybody's there because they want to be there, let alone everybody don't want to help you or precept you or anything like that. If you're having issues with your preceptor, you need to go talk to the manager and see about getting a different one. Be mindful of that. So that's number 1. Number 2, what you should never do as a new nurse, you should never just wing it. What does that mean? Wing it simply means that you really don't know what you're doing. And you just feel like I'm going to go in there and do the best I can without any regard for the policy, any regard for questions, any regard for the appropriate intervention, the appropriate steps, the appropriate dose, the appropriate anything. You cannot just wing it. If you don't know how to do something, you need to ask questions. I don't care how annoyed your preceptor or any other nurse gets. Keep in mind, this is your nursing license that we're talking about. You have a nursing license. And they don't care if you lose your license or not. They just don't, okay? You're the only one who cares about you. Nobody cares about you but you. I tell people that all the time. Nobody cares more about you than you. I guarantee you they will make sure they do things correct way and not tell you the correct way. Sometimes to sabotage you, sometimes they don't care nothing about you. That's just kind of how it is. So whatever you do, do not just wing it. Make sure you know how to do it. I have actually had to look at YouTube videos. I've had a situation even recently in the past, let's say 2 years, or actually past year, where I didn't know how to change. I want to say it was a pico dressing that I know how to change because it was new to us. And because I didn't know how to change a pico dressing, I had to go on YouTube because nobody would teach me, or nobody was there who knew how, shall I say, to teach me how to do it. So I've had to look at things and try to learn myself how to do it, but I didn't just wing it. Let me just go there and pull the dressing off and see what happens. No, I did not do that. I actually went and looked it up and try to figure out from there. I watched the videos, I looked it up, I looked at the instructions on the box, I did all those things, and then, changed the dressing myself. So do not wing it, ask questions. Number 3, do not get behind in your med pass and or charting. Now, with this being said, all nurses have gotten behind from time to time to time in one or both of these. That's normal from time to time to time. Sometimes you have a rough shift, and when you have a rough shift, things just get behind. That is normal. What I'm saying is, make sure you devise or learn how to time manage. You have to learn how to time manage so you are not constantly getting behind in one or both of these. It is so unnerving for you, or it will be for you, to get behind in your charting and or med pass, because it makes the whole day derail after that. And nobody wants to sit at work for 13, 14 hours trying to chart from the entire day. That is something once you do it once or twice, you will try your best to never let that ever happen again. That's just the truth behind it. Do not do that. Do not get behind in your med pass and or charting. Find out what the policy is at your facility regarding med pass. At our facility, we can pass meds up to 1 hour early and 1 hour behind. So as an example, if the medication is due at 9 o'clock a.m., 0900, I can pass that medication as early as 8 o'clock and as late as 9:59 a.m. for that one med pass. So for me, if I have a lot of meds to pass, I'm starting my med pass at 8 o'clock in the morning because I can do that. If your med pass is a 30-minute before and 30-minute after, then you can only start at 8:30 to 9:30 for your med pass if that's what your hospital says. Again, you need to follow your policy at your facility, but I'm just saying, if they tell you can start at a certain time up to so many minutes early, then you need to start on the earlier side, especially if you have 5 or 6 patients who have multiple medications. Go ahead and get that in a habit of doing that, starting things early and not say, okay, it's 9 o'clock, let me go ahead and pass my 9 o'clock meds. No, by the time you start passing meds at 9 o'clock, if you have 5 or 6 patients, you're already too late. You are late. Go ahead and start passing those medications as soon as you possibly can, as long as your facility allows you to do so. Number 4, never as a new nurse should you do something because everyone else is doing it. Now, I am really big on what is your rationale. When I ask my students, why are you doing something? I need a rationale as to why, and it better be evidence-based research and practice as to why you're doing something. The notion that Nurse Smith done taught me to do something does not hold you in court. You cannot use that. So what you need to do is simply say, let me go find the policy on that. Let me research that. Evidence-based practice suggests this, or evidence-based research suggests this, not because nurse such and such told you to do it. What you will find yourself doing is, when nurse such and such told you to do it and you get in trouble for it, nurse such and such is not going down for it. You are. Keep in mind, when it comes to patient care, the person who did the intervention, which is usually the nurse, right before the incident happened to that patient, is the ones going down for it. Here's an example. If this has nothing directly to do with that, but let's say, for instance, pharmacy messes up and sends you the wrong medication, or maybe the right medication, but wrong dose. Well, they send the medication to you. You look at it like, okay, this looks right. You didn't really verify it, but it looks right. This looks like what I'm supposed to give. And you give the wrong dose of the medication. Is pharmacy in trouble for that? Not more than you are, because you're the one who gave the medication. You're supposed to be the one who looks at the medication and say, okay, you know what? This is not the right dose of this medication. I need to call pharmacy back and talk to them and say, okay, we need to fix this. So you are the last person before the patient gets something that is going to cause them potential harm. So again, don't do something because everybody else is doing it. Make sure you know why you're doing what you're doing. Have that backed up with policies and procedures and so forth. Okay, so that's number 4. And number 5, last but not least, is as a new nurse, you should never go PRN or travel without a full year of full-time nursing experience in that one specialty area. And I say that because I've known nurses who have been in 3 specialty areas in their first year of nursing. You cannot know or be an expert, by no means, in a specialty area in less than a year anyway. But because of the fact that most PRN jobs and most travel jobs require a year, sometimes 2 to 3, of that specialty, you need to make sure you've been in that specialty for a full year. So make sure, let's say for instance, you love being a labor and delivery nurse, but this particular hospital right here is not cutting it. They're mistreating you, or they're doing something, whatever they're wrong to you. Try to hold out for a year if you can. If you cannot hold out for a year, try to go to somewhere else, but in the same specialty if you happen to like that specialty. Or if not, you don't like that specialty, it's not what you thought it was, go to another specialty. Okay, we'll still go do another year there. So let's say you started at an L&D, realize it's not for you, and you want to be an ICU nurse. So you stayed at L&D for 6 months. So at 6 months, you moved over to ICU. Go to ICU and stay there for a year. That means you've been a nurse for a year and a half at this point in time. Go do that before you start doing PRN or travel nursing or whatever the requirement is happens to be for those particular assignments, so that you are well versed as best as you can be. I won't say well versed, but versed in the specialty area in which you chose. You have nothing to offer anybody if you are PRN, but you don't know how to do your job. You really can't travel and be effective travel nurse just to make that money if you don't know how to do your job. And for travel nurses, anybody's a travel nurse, you can comment below. But travel nursing, they do not give you much of any orientation. They give you like 2 days, and you better learn it. They give you like maybe a day of hospital or two days of hospital orientation, and maybe 2 days on the floor, and that is it. You better learn it, pick it up, and keep it moving. So you don't have time to go into an area not knowing what you're trying to do and trying to be PRN somewhere where you're only going to work 1 day a week, 1 day a month, whatever it happens to be. All right, so that sums up the 5 things you should never do as a new nurse. If you have other things, anybody can think of things that you should never do, just comment that below, add it to the list. I want to make this kind of a brief video so that you can just kind of get the highlights of what I feel is the most important things. There are plenty of other things you should never do as a new nurse. And if you notice, these were not really skills. These were not really skills related, because in my mind, skills are repetition. I'm not worried about skills when it comes to a new nurse, because you can always learn how to start IVs. You can always learn how to put Foleys in. You can learn how to change dressings. You can do that with repetition. You do it over and over and over again. It's your critical thinking skills. It's your reasoning. Why am I doing what I'm doing? It's your thought processes. It's your social skills, your relatability skills. How can you relate to one another, to other nurses, to your patients? That's what's important to me. Again, everything else you can learn, is repetition. So anyway, that sums up this video. Continue to enjoy these videos here for Nurses Week. I'm so excited. I love Nurses Week every single week. Every single year, because of the fact that it is about us. It's about us as nurses. And so the ones of you who are new or nursing students who are welcoming, or we are welcoming into nursing, my sisters and brothers in nursing, we welcome you, and we hope that Nurses Week is going to be great for you, as it is for some of us. Now, some of us don't get any prizes or anything special for Nurses Week at our hospitals, but it is what it is. We're going to celebrate on our own here on my channel. So this is what it is. So anyway, please follow me on IG. It will be somewhere here below. Also, I'm on TikTok now, and I actually do a lot of Q&As on TikTok. So here's the TikTok one as well. So you can go over there and ask questions, and I will respond back with a video typically. And if there's enough questions over there, sometimes I bring those questions over here as well. So if you definitely want to follow me on both of those, IG and TikTok, to know more about me, to know about nursing. And until the next time, I see you in the next Nurses Day video. Nurses Week. Nurses, I will see you in the next Nurses Week video. Comment, like, subscribe, share. Until next time, you all take care. Bye-bye.